Okay, well, we have an Executive Director, Sickle Cell Advocacy Management Initiative, Toyin Adeshola. Good morning.
Good morning.
Thanks
Morning,
for
Toyin. Nice to see you.
joining us.
Thank you.
Very troubling to hear that Nigeria is actually a leader when it comes to sickle cell disease in the world. 150,000 babies born
annually. Yes.
Annually.
Yes.
Paint a picture for us.
Well, because we are the most populous African country, and because we are a sub-Saharan country where malaria resides, we have the highest number in the world. And even the sickle cell trait, which is the gene that carries and results in the sickle cell disorder, we are about 40 million. So we have a large number, yes, we have about 40 million in the country. So we have a large number of potential, should I say, carriers of the sickle cell disorder. So it's really challenging, and because of our healthcare in this country, that's why we see a lot of births with sickle cell. 75% of those who are born don't even live to their 5th birthday because we don't have that proper care that is supposed to have started right from the beginning of the birth of the child. We don't even have newborn screening to even know as soon as the child is born that the child has sickle cell. So, and you know, sickle cell doesn't, how will I call it, doesn't show until maybe like 2 years and above, depending. So you don't really know when the child is born that the child has sickle cell because we don't have newborn screening. So it can be challenging trying to manage a child with sickle cell.
Maybe we should even start by defining exactly what sickle cell is.
When it comes to the issue of sickle cell, the word is very popular.
Yes.
But what really causes it is one thing not so many people understand. What really causes it.
Yeah. First of all, sickle cell is an inherited blood disorder. We inherit it from our parents and from their genes or genotype, as it said. And the most common genotype that we normally use an analysis for is if your both parents are AS. Now, the S gene came about nature's way of protecting people against malaria. So you find somebody with AS genotype less likely to have issues with malaria than somebody with AA genotype. But along the way, there was a mutation which resulted in the SS gene. And that's resulted in sickle cell. But there are various other derivatives of sickle cell, depending on the part of the country or part of the world you're coming from. There's SC, which is more common in Togo and southwest Nigeria. And there is thalassemia, beta thalassemia, which is more in the Mediterranean, Arab, Asian countries. So there are different variations of sickle cell. But because of that sub-Saharan malaria thing, we have sickle cell.
Now, when you use the word mutation, and there was a mutation at the cause of, was the mutation caused naturally, or is it a product of medicines or drugs or environment or anything?
Well, I'll call it a freak mutation. Okay. Nobody really knows what caused it. Maybe it's to do with the genes itself in the some genetic thing in the S gene. We don't really know, but it was almost like a freak mutation which resulted in, and it wasn't till the early 1970s that people even didn't know that there was anything like that.
They put a name to it.
Yes. It was American, I can't remember the name right now, but it was an American medical person that discovered and put a name to it because of the way our blood cells is. Let me explain. The normal blood is round and soft, so pliable, can move up and down the blood vessels easily, but ours has a sickled banana shape and is hard. And then, when it's flying up and down, because of oxygen issues, it can get stuck, and you have a pile of them getting stuck, and that's what causes the crisis pain. And because of that getting stuck, oxygen sometimes is blocked in certain areas, so you have different complications from stroke to what they call avascular necrosis, which is like a debilitating of the bones. That's why you have some of us needing hip replacement, and you have acute chest syndrome, blindness, different things. Anything that blocks, the normal flow of oxygen and everything.
And in spite of these challenges, in a place like the United States, people live up to 60 and beyond. Yes. Unfortunately, you can't say the same about Nigeria.
No.
Talk to us about the management of sickle cell anemia, especially on the individual level, because it's one thing to expect so much from government, it's another thing to help yourself you know, making the best of a bad situation.
Exactly.
Yeah.
Yes. Well, there are two levels to management. There's the physical management, which is your knowing your health status, what to do, what triggers your crisis, because everybody's individual experience, although there are general things like infection, malaria, cold weather, dehydration that triggers crisis, but everybody's experience is different. So we always tell people, know your body, know what triggers it. There's a physical aspect. You need to know what drugs to take and all that, how many times you're supposed to see your doctor and all that. Then there's the emotional aspects, which people tend to neglect because we go through a lot of emotional stress due to stigma, neglect. You'll be surprised, parents, especially from low, underprivileged income, because of the pressure of finance, they tend to abandon the children or tend to make their children feel less than they are. So there's those two aspects, and you know, the challenge is the healthcare in this country doesn't help. You know, our healthcare is very poor, and a lot of medical personnel don't even understand how to manage sickle cell. They don't understand the level of pain we go through. I have said that it's even worse than slam, because I've slammed my finger on a car door and broken a bone. And somebody was like, wow, you think? I said, well, the pain I go through on a regular basis is nothing.
This is nothing compared to it.
And people who have even given birth and have sickle cell have even said that people are saying, oh, you're not screaming and you're giving back. I said, no, because the pain I go on a regular basis is really bad. So they don't understand. They think, oh, it's headache pain. I've had somebody tell me, oh, you should be used to the pain by now. But the reality is that there's no way you can get used to sickle cell pain, because there are different, how will I call it? Levels of pain, you know. And it can be really, really bad. That can lead to your death if you're not careful. And when proper care and immediate care, because I always say that emergency, it is an emergency when somebody is in crisis, but they just leave you there. They even tell you you're in crisis, go and get your, especially in public hospitals, they tell you go and get your foil, and you're in crisis. There's no way you can do that when you're in crisis, and that's because they don't understand what it is. They think you are a hypochondriac, pretending that you're in pain. And because of this, you find a lot of us, as people living with sickle cell, we try and do self-medication. Unfortunately, it leads to another problem, which is addiction, because some of those drugs are quite addictive, like tramadol. I'm sure you've been hearing the news. And we fall into that space because we don't receive the health care. So like, oh, let me go and treat myself. I'm in pain.
Get as much painkillers as possible.
Now, the issue of World Sickle Cell Awareness Day, it's been on for so many years now.
This is the 9th.
Exactly. Yes. But as it is in Nigeria, where we find ourselves, what impact are these commemorations helping in the area of awareness amongst Nigerians on what sickle cell is and how to manage it and even how to prevent it and all of that?
Well, I think in urban areas, let me use urban areas for instance, there's a lot of awareness. People now know about sickle cell. People now have a better understanding of what sickle cell is. Whether they make the right choices is debatable, because people, it's their choice. At the end of the day, you can only advise. You can't force somebody to do something. But there's that awareness in urban areas. The only challenge I find is that in less urban or rural areas, there's still that superstition that, okay, my child is having an issue, there's a spiritual problem, and, you know, and the father goes, oh, it's not my child, it's your child, you know. But in terms of, compared to before and now, there's a lot more awareness regarding sickle cell, and especially when it used to be that people used to mistake genotype with blood group. Now I think people are understanding they are two separate things entirely, you know.
But there's a difference between awareness and, of course, action. Not too long ago, a religious leader actually recommended, you know, the need for prospective couples to go for that genotype test. And it sort of whipped up some kind of controversy. I wonder where you stand with that. Would you, you know, based on your own personal experience, would you recommend that really should be the way to go?
Well,
if that will help in minimizing the numbers.
Yes, in a way, and no. The challenge with minimizing things is that people can easily forge results when you force people to do things. So I always recommend that encourage them. Let them understand, because there's a thing in psychology, don't say no, give them the reason why. It's like telling a child, say no, 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 no. I don't tell the child why. The child now feels, I'll do whatever I want. So the same way, going to tell a couple to get informed, get your genotype tested, tell them why, give them counseling on what might happen so that they are more informed and they can make better choices rather than just a capital no. And unfortunately, the churches, yes, they do counseling, they tell you go and do your genotype, but they don't educate, and they're not equipped to counsel these couples that this and this is what is going to happen. So they just, those ones go, and unfortunately, there are labs with issues.
All right, so the window of prevention starts from marriage? Is that where it starts from?
I think it starts way before marriage.
Okay.
It's still, you know, we leave it till when the couple is already, let the person, even secondary school level, I start educating people about knowing their genotype. Why is it important to know your genotype? What are the challenges that can occur? Because then the person is better prepared. You know, people who know long before are even better prepared. I've met people who say, oh, because they were taught this. Oh, when they came into a relationship, they found out that, okay, no, this one I cannot cope. Because let me tell you, it's a lot of emotional challenges with the parents and capital intensive. And they don't realize it because they are not informed until they are into it. And then you find marriages having issues, trying to battle to help a child and all that stuff.
Talk to us about this concept or idea of immunization and genotyping for early detection of sickle cell. I've heard in some other reports that actually it would prevent sickle cell anemia. What do you know about that? Immunization I think is more in the sense of there's what you call prophylaxis, where you can give either pneumococcal vaccine, because to prevent infection of oral penicillin. So that's why I was saying that. Is that after the fact?
Yes, when the child is born.
When the child is born.
As soon as the child is born, you do certain things to help the child build immunity, because infection is one of the challenges we face. And when the infection comes, crisis comes, and you have other complications. So when the child, that's why if you have the newborn screening, as soon as the child is born, you know that this child has sickle cell, then you can start administering all this prophylaxis, and the child has a greater chance of living and surviving.
But is it known anywhere in the world where there are research into vaccines directly for sickle cell?
No, there's no vaccine. What there are drugs that help reduce the number of crises. And then, of course, with the cure of stem cell and bone marrow transplant, that has been working for some people. Unfortunately, it's a very expensive venture. And so it's not every family that can afford it. And then you have to have a match, like any donor, whether it's heart transplant or kidney transplant. You need to find a match, and it's not easy to find. Then you have to spend money, a lot of money, over 10 million, 15 million, depending on where you're going, just to do that operation.
Now, that's a lot. Are you saying then that with stem cell, the breakthroughs in stem cell, technology and all of that, there's the chances for sickle cell person to survive are very high?
Oh, yes. I've even known a couple of people who have done it, and their child is doing very well. Very well.
That's amazing. So what are the, what do you have lined up for this year in terms of really bringing, that education about sickle cell to people?
Well, we belong to a member coalition of sickle cell NGOs, and one of the things we realize is that speaking one-on-one as one doesn't have impact. So we as a coalition are coming out for more advocacy and more awareness. We're planning to educate more people on sickle cell and the issues of sickle cell, especially educating also the medical practitioners. We believe we need specialist nurses. Abroad, they have specialist nurses, so that in every hospital, there's a specialist nurse that knows how to deal with people with sickle cell as they come in. Because as I said, medical
and that seems to be lacking.
Yes, it is lacking. It is lacking. So we're trying to advocate for that. And I know government cannot do, because they have so many things to do. So much to do. That's why we will talk about, look, it doesn't necessarily have to be government. Private sector, like the newborn screening, the kits, the machine.
Yes.
I mean, a private sector can just say, okay, we bring it in. We'll find a way to subsidize it so that people can come and do it, like genotype tests. And it helps and improves the child's chances of living.
Yeah, we know you said, government alone cannot do it, but what about funding? We touched on that earlier. Funding, not just to treat sickle cell disorder, but research. Because every now and again you hear, you know, you read the papers and you know, some kind of sensation. Oh, the cure to sickle cell has been discovered, only for that bubble to be burst.
Yeah, that is a challenge. Unfortunately, we live in a country where research is not sustained. You start
it's not even given priority.
Yes. So you start it maybe through some people, but it needs sustainability. And it's only through private sector or government that can fund this research, because we have what it takes in this country. Unfortunately, our eyes are closed to it because it is our own disease. There's no, I personally believe that there's no disease that is born from this country or this sub-Saharan that does not have a solution.
From within.
Yeah, you know, and it's mostly a quote-unquote black man's disease. That's why it's taking so long. But you'll be surprised now abroad that they're taking it on as a project to do research.
All right, we have seen different campaigns by government. Kick polio out of Nigeria, kick measles out of Nigeria, and so on. There hasn't been any such kind of campaigns for sickle cell. But if there is a strategy by government, do you think is possible to achieve within maybe 5 to 10 years?
It depends on what you're achieving. If it's eradication of sickle cell, I always believe there's no way you can, as long as malaria exists, there's no way to eradicate sickle cell.
There's a link between malaria and sickle cell?
I explained it because that S gene keeps multiplying because of nature's way of protecting us against malaria. So once that gene is still there, it's difficult to eradicate, but we can reduce, and that's just by educating, you know, people about the importance of knowing their genotype, and then just educating people about stigma in general. You know, I mean, when HIV came out, there was a lot of campaign against stigma. But here in sickle cell, you don't see that. But
how bad it is? What form of, I mean, when you say stigmatization, what form does this really take? Of course, you talked about, you know, parents hiding their kids, you know, and all of that.
Well,
talk to us more about that.
Two areas. One, in terms of work, employment. People have this mindset that because you have sickle cell, you'll be falling sick every time. And that's not true. Everybody has their own challenges, and everybody has their way of falling sick. It's not everybody that falls sick every time, depending on how well you manage yourself. You just can't do anything that is too over physical. So, and the truth of it is a person with sickle cell have greater intelligence. So their mind is very, very active. So it's not possible that they will fall sick every time. But we have that mindset that, oh, if we employ this person, I know somebody who he passed everything, but once they did the health check, found out he was sickle cell, they said he wasn't qualified. That was it. And you find that people hide their information now when they get employed. And unfortunately, it's detrimental to them because if something happens, crisis happens, they don't know what happened.
They don't know how to handle it.
Even in schools, parents hide the information because they don't want their child to be stigmatized. And the teacher will be wondering what's happening with the child and calling him lazy, calling him all sort of names. And the person's self-esteem starts going down. Then in terms of relationships, you know, marriage, you have people saying, oh, if I marry this person will die, I will be a widow, or she can't give birth, or things like that. But that is not, there are people with sickle cell that have children, that are living very, very successful lives. People living in high places. But again, with the stigma, nobody wants to come out.
All right, so much to enlighten people about when it comes to the sickle cell issue, especially in the area of stigmatization. Executive Director, Sickle Cell Advocacy Management Initiative,